When President Obama signed the Patient Protection and Affordable Care Act, also known as the PPACA, he said, "The law is intended to enshrine the core principle that everybody should have some basic security when it comes to their health care." Why did we need the PPACA? Protection against the high costs of healthcare. Approximately 45 million people uninsured in 2008. Many people lack access to healthcare insurance and health services, causing disparities. Many people are receiving low-quality healthcare, and there is an inadequate emphasis on prevention, which could lower healthcare costs. What does the PPACA do? In 2010, upon the passage of the law, children were allowed to stay on their parents' health insurance policies until age 26, resulting in the acquisition of coverage by 3.1 million young adults by the end of December 2011. There are also pre-existing disorders that could no longer be turned away from insurance plans or be subjected to higher premiums or lifetime limits on coverage. Additional benefits. Senior citizens will benefit from an added amount of preventative services that doesn't include cost sharing, and the ACA provides discounts on these drugs when seniors are in the donut hole. Another benefit for Americans is being able to have the privilege of choosing their preferred doctors along with emergency facilities without prior consent. Essential health benefits. There are 10 basic healthcare services to be provided through insurance plans, based on the belief that all citizens have a right to healthcare services. Affordable care organizations. Affordable care organizations, also known as ACOs, are bonuses to hospitals, nursing homes, and physicians for providing quality and efficient health care. It will come into action in 2016. There are also antitrust and kickback violations that cause problems within the Affordable Care Act. Medicaid expansion. Medicaid expansion uses a mechanism for reducing the number of uninsured Americans. Medicaid has expanded to include individuals between the ages of 19 up to 65, which include parents and adults without dependent children, with incomes up to 138% FPR. It began a national pilot program for expanded bundle payments, which include hospitals, physicians, and many more. Expansion difficulties. The PPACA threatened to withhold federal funding if states did not expand federal funding. This led to the National Federation of Independent Business versus Sebelius, where 26 states filed constitutional challenges with the Supreme Court. Exchanges. Exchanges are provided to meet the insurance mandates. Small businesses along with individuals can purchase health insurance through exchanges. Premiums and cost-sharing credits are available to citizens who are between the 133% and 400% of the federal poverty income rate. 4 benefit categories and a separate catastrophic plan to be offered, which include bronze, silver, gold, and platinum. There were also various court challenges that were involved. NFIB versus Sebelius occurred on June 28, 2012. The Supreme Court upheld Medicaid expansion but limited the federal government from withholding funds from states if they didn't expand Medicaid. Howbig versus Sebelius, also known as Howbig versus Burwell, occurred in July 22, 2014. D.C. Circuit Court decision was that the individual tax credits in states without exchanges was invalid, and upheld mandate for individuals and businesses to have minimal essential healthcare insurance. Another challenge was the Hobby Lobby, which took place in June 30, 2014. D.C. Circuit Court decisions regarding employers can determine what contraceptives they want included in their employee benefit packages based on the employer's religion. Businesses, large and small. Bigger businesses with employees of 50 or more are now required to offer health insurance to full-time employees. Businesses below 25 employees will be entitled to tax credits. Private insurance changes. Medical loss ratio. Insurance selling policies to individuals or small groups to spend 80 to 85% of premiums on direct medical care and efforts to improve the quality of care. Premium reviews. Required insurance companies to justify proposed rate increases for health insurance. Insurance companies cannot raise rates by 10% or more without first explaining the reasons to the state or federal rate review program. State-based reinsurance and risk programs. Reinsurance programs in each state requires health insurance issuers and third-party administrators, on behalf of self-insured group health plans, to make contributions to support reinsurance payments that cover high-cost individuals and non-grandfather plans in the individual market from 2014 through 2016. Risk adjustments provides payments to health insurance insurers that disproportionately attract higher risk populations, such as individuals with chronic conditions. Risk corridors protect against inaccurate rate setting by sharing the risk, also known as gains and losses, after reinsurance and risk adjustments. Implementation of issues. Even after healthcare is implemented, there are expected to be more than 30 million uninsured people in California. There is a growing risk of not being able to fund Medicaid and Medicare due to an increase of unemployment. California faces budget challenges that threaten not only Medi-Cal performance, but also the ability to improve care to additional 1.7 million beneficiaries. California has one of the lowest rates in Medicaid physicians. They will need to hire 350 new physicians to provide primary care to Medicaid beneficiaries. Financing health reform. Taxes. Taxes excise on insurers that insure plans with aggregate values that exceed $10,000 for individual coverage and $27,500 for family coverage. Increased Medicare Part A tax rate on wages on earnings over $200,000 for individuals and $250,000 for married couples. It imposes a 3.8% tax on unearned income of higher taxpayers. There are also limits. Deductibility of executives and employees' compensation to $500,000 per applicable individual for health insurance providers. Imposed fees. Mandate penalties on individuals and businesses. It excises tax of 2.3% on the sale of taxable medical devices. And also tax of 10% on the amount paid for indoor tanning services. The Civil Rights Act of 1964, Title VI, created to ensure there is no discrimination between the patient and provider, or gender, race, and ethnicity, or language barrier in any institutions that receive federal funding, including hospitals. The Civil Rights Act of 1964, Title VII, prohibits employment discrimination in the workplace. Disparate treatment. The employer simply treats some people less favorably than others because of their race, color, religion, sex, or national origin. Disparate impact. When employment practices appear acceptable in their treatment of different groups but are really more harsh on one group than another. It would require remediation checked on based on history. Civil Rights Act of 1964, Title VII, would carry an example of sexual harassment case, also known as Baldwin versus Blue Cross/Blue Shield of Alabama. There are also other types of discrimination, which could also be known as D.C. Circuit Court and the Hobby Lobby. Thank you for listening to our presentation.